Tonight on Mississippi Insight, Hurricane Sally hits the Gulf Coast. Not a direct hit on Mississippi. It's the fourth named storm to impact our state this year, and there's still more than 2 months left in hurricane season. Hello and welcome to Mississippi Insight. I'm Byron Brown. Thank you for joining us. We begin with the impact of Hurricane Sally. Well, this storm comes just weeks after Hurricane Laura and Tropical Storm Marco, and earlier this summer, Tropical Storm Cristobal. There are more storms churning in the Atlantic and 2 more months left in hurricane season. It's important to make sure that your insurance is up to date. To talk about what to do is Insurance Commissioner Mike Cheney. Commissioner Cheney, what is the biggest insurance concern right now amid the hurricane season that we need to know about?
Well, the biggest concern is, do I have flood insurance? Because both of these storms, Laura and the storm we just had, Sally, as they call Sally in the alley, were flood events, water events. So if you don't have flood insurance, you need to check it out. Your homeowner's policy generally does not cover flood insurance. So what you need to do is call your agent, and if you need flood insurance, you're on a floodplain, ask them if you can buy flood insurance. It has to be bought 30 days before an event, before it will take place. If you're in doubt or if you're computer savvy, just look it up on your county flood maps. It's easy to do. Go to FEMA.gov and go under the flood. It's easy to look it up.
If you're not in a floodplain and you might likely flood from an event like this, should you still have it? You
should still have flood. Flood's really cheap. People would not think Alcorn County and North Mississippi up close to the Tennessee border would need flood insurance, but the areas in Alcorn County that are not truly in a floodplain, but they tend to flood because of drainage. So we tell folks, ask your neighbors, know the history of where you live. If you've had big improvements in, say, parking lots or in shopping centers that will cause more runoff water, consider buying flood. Flood insurance is something that's crucial.
I know during Hurricane Katrina, there was a lot of debate about whether it was wind or rain that caused a lot of damage. Where are we 15 years later when it comes to those issues?
Well, the courts on wind versus water, that was a big issue during Katrina, and the state wind pool paid out a lot of money for flood events, and they weren't really covered by the wind pool, but they paid for them because that was the right thing to do. And then we have, of course, we had lawsuits on the other side by the Attorney General that came in 2014 that said, well, we had a lot of companies that shifted claims to the flood insurance program. And it's been a real nightmare for me as the insurance commissioner to try to get through all of this. But the courts rule that wind and water, you could determine what was done by the wind and what was done by the water in case there was a flood, and it could be paid. And of course, that makes the insurance companies have to pay for the damage done by wind, and if you have flood insurance, they will pay for the damage done by the flood. We've worked through that. We had almost 8,000 cases. Well, 6,700 of them were adjudicated by the federal courts. Judge Sunner, who's now deceased, did a wonderful job, had only 1 lawsuit out of that. So we worked through those problems, and we'll continue to do so. And companies are more responsible today to the consumer than what they might have been during Katrina.
Let's look at the numbers here. There are just over 66,000 flood policies in Mississippi. Almost all are through the National Flood Insurance Program, and there are more than 500,000 homeowner policies. Is it difficult getting people to make a move and upgrade their coverage? Is that difficult to do?
It is difficult to do, but on the Gulf Coast, we have a company that was started after Katrina, Coastal American, and that company has about 1,400 policies that are private. They're endorsements to the homeowner policy. And then we have companies like Lloyd's of London and other what we call surplus lines companies that write insurance. We've got a little over 1,000 policies that are written by the private industry. So we've got almost 3,000 policies, 2,700, 3,000, and that's the best count that we've got. That are private, and then the balance are all national flood insurance programs. Those numbers are hard to pick out if you go on the website, but I'll tell you the number is very close to 65,000 on the National Flood Insurance Program. Our push has been that program needs to be renewed for more than 90 or 120 days. It should be a 5-year program so consumers know what their premiums will be day in and day out, and whether or not they're grandfathered if they go back and forth and they lose and move their house. They want to be certain they're still covered.
This could be one of the busiest seasons ever, topping 2005. We're seeing earlier this year we had tornadoes or record flooding along the Pearl River and a COVID-19 pandemic. What's the impact on the insurance industry that we're seeing because of everything that's happened?
We will not see any impact in Mississippi over what's happening, say, in Louisiana or what has happened in the Caribbean Basin or in the Atlantic side. Most of the premiums are determined by the risk factors that you have within your state for homeowners. But on the flood side, And on the reinsurance side for the wind pool, we'll probably see an increase. Actually, I have a filing from the state-run wind pool for a 15% increase. The indicated rate from the actuaries is 27, and I told the Senate hearing last Thursday that we will probably grant that increase. And let me tell you why. We haven't had an increase on the Gulf Coast by the state-run wind pool since 2008, since I took office. We lowered the rates in 14%. We gave them a 3% adjustment for all the houses from the railroad track or I-10 to the beach, and they've been very consistent. We've had 11% decrease average since 2008, so it's time. And you got to remember now, for the consumer that's listening to us, and why do they get a break? Well, that was an Economic Recovery Act to try to help jumpstart the economy back on the coast, and it seems to work. So to answer your question very succinctly, I don't think we'll have much increase on homeowners. You will see an increase because of the cost of reinsurance on flood and surplus lines wind.
If you're not a homeowner, but you're a renter, you rent an apartment or you have a condo, what should you do to protect your property?
You need renter's insurance, and if you're in a condo, you need, same thing, renter's insurance or condo insurance. And your condo association, if you own a condo, will cover to the wall, and you're responsible for inside. So if you pay a condo fee, you're probably paying for that coverage on the outside, and they buy big blocks of insurance from reinsurers to cover those facilities, especially from what we've seen at Orange Beach. A lot of those units that were damaged, and we've already gotten damage reports, are on the 4th, 5th, 6th, 7th, 8th floor. They're up high and the windows are blown out and water blows in and you have damage. So those people need some type of insurance, and most of them, if 99% of them, have something called condo and renter's insurance.
So does the renter's insurance cover the flood?
River insurance will cover, renter's insurance and condo insurance will cover the rain that blows in. Think of it like this. If it falls from the sky, it's covered by your homeowner's policy. If it comes up and rises from the river or the ocean, unless you have flood insurance, you have no coverage. Mm-hmm. Makes sense.
Makes sense. Definitely makes sense. So people should make sure they get covered no matter what.
You need to look at coverage is cheap. It's cheap. I know you got a lot of pressure on your pocketbook, but coverage is cheap if you live in the lower, especially the lower 6 counties or anywhere south of Hattiesburg. You really need to consider flood insurance.
Central Mississippi, should they consider flood insurance in Central
If you're along the Mississippi River, you really need flood insurance. You got some areas in Madison that need flood insurance. You got areas in Rankin County. We've had to work through the floodplains there with FEMA that you really need flood insurance, especially Warren County, where I live. I still live in Vicksburg. Been there over almost 50 years now, and we see areas flood all the time. And we tell those folks, either you got to build out of harm's way or you got to have flood insurance. And if you're building, by the way, on the Gulf Coast or areas that may be in a floodplain, we do have building codes in the state, and we tell you don't build in a floodplain. It's just not something smart to do. You shouldn't be able to get a permit to do that anyway.
And we had the Pearl River flood earlier this year.
Yes, we did.
What did we learn from that experience as far? Were people covered for that?
A lot of people were not covered, Byron, for the flood from the Pearl River, and we've tried to tell folks, if you're in doubt, talk to your county agents and look at the flood maps from the county. They'll tell you whether or not you're in a floodplain. And if you live close to the Pearl River, you probably need flood insurance.
So when in doubt?
When in doubt, buy flood insurance.
All right, sounds good. Meantime, there's more important news to know about open enrollment for Medicare. We're talking health insurance with Commissioner Mike Cheney when we come back. We're back with Insurance Commissioner Mike Cheney, and you want to let us know about the important dates for Medicare recipients. Tell us about Medicare recipients, what's going on.
Well, if you have Medicare, you've turned 65, and you got to have Medicare, and you got to have a Part B. If you don't buy a Part B, you're going to be penalized. So open enrollment for Medicare starts October the 15th and runs through December the 7th. And you'll have another little period that you can enroll from December to the 1st of January. But by and large, you want to enroll into Medicare between October the 15th and December the 7th. Now, remember this, if you buy Medicare Advantage plans, you have networks. So if you buy an Advantage plan, ask the person who sells it to you, is my doctor in the network? We get a lot of complaints sometimes that they don't cover, the Advantage plans do not cover my doctor or my network. You need to check before you change plans. We have a lot of good Medicare Advantage plans out there. It's a federal insurance program, as most people know. And by and large, you just do not have a lot of complaints except on the Advantage side. Be sure what you're buying. And if you're on a lot of drugs, we tell you to buy a drug plan that fits your need. And it's easy to look at. If you need help, go to www.mid.ms.gov. And we have on our website a Medicare supplement. Every agent that sells policies in this state is listed with an 800 number, so you can call them all and you can look at what they offer you and the type of program that's best for your particular situation.
Should seniors buy an Advantage plan?
Seniors should buy I don't tell them not to buy an Advantage plan, but if you buy an Advantage plan, just be certain that your doctor or your physician is in the network. A good example would be up in North Mississippi. The hospital refused to take Humana's Advantage plans, and we had 8,000 people that had to change doctors in midstream. And that's really hectic when that happens. It wasn't Humana's fault. It was a hospital just refused to take them, and the hospital's area said, well, we weren't getting enough money, so we're not going to take them anymore. We want more money for the service that we perform. We tell you this to say, be sure and talk to the agent that sells you your Medicare Advantage plan, and be certain that your physician or the drugs that you take are in the benefit plan.
There is a lot of talk about, we're in an election year, there's a lot of talk about health care and pre-existing conditions. What should consumers know, or voters know, or people know about what's going on as far as health care, pre-existing conditions, and what they should be looking for? Pre-existing
conditions will continue to be covered regardless of who's president or who's elected in November. Whether it's Biden or Trump, pre-existing conditions will still continue to be covered. It would take years to undo that, even if you hear all the rhetoric about we're going to repeal the ACA. Only the courts can make something happen that quick. So I don't see anything going away on pre-existing conditions. If you have pre-existing conditions and you buy a policy from that's ACA compliant, you're covered for that pre-existing conditions. Now, there are some plans like healthcare sharing ministries where people pay into a pool through a church, and they're legal. They're not really insurance, but they may have pre-existing conditions and limitations on pre-existing medical conditions.
How is the ACA doing in Mississippi?
The ACA is doing very well. You're talking about the Affordable Care Act. It does very well. We'll probably have over 100,000 people this year. It depends upon the economy. If somebody makes less than 100% of poverty level, they cannot buy on the ACA. If they make more than 250%, it's better to go out into the private market instead of buy on the Affordable Care Act, because between 100% of poverty level, which is about $14,000, to the 250% level, you get a tax credit. But after you reach that 250 to 300% level, you get very little credit, and you're paying just about what you would pay in the open market.
As far as leaving your children on the plan until you're age 26, is that going to be impacted at all?
That will not be impacted. You can leave your children on to age 26. And that's a pretty wise thing. If you have a child in college or someone that's working part-time and going, say, to a community college to try to learn a skill, leave them on your health insurance policy. It's really reasonable to do so.
Yeah, with the pandemic, there's been a lot of concern with people not having coverage or losing coverage, or what they should do. So what's your advice to people out there?
Well, my advice is during the pandemic, I really would leave. If you got a child, I'd leave them on your program. And let me say this about the pandemic. Besides, I'll say this again, wear a mask when you're out until we get a vaccine that's working, and wash your hands. But if you want to be tested or you are tested, your health insurance company is required by us and the federal government to pay for that test. And if somebody tries to hoodwink you and make you pay for it, you need to call us at the department at 1-800-562-2957. The second thing I want to tell you, you can do a lot of your office visits if you have a known physician that you work with through telemedicine. And telemedicine is something that we encourage folks to use. It's very cost effective. It delivers good health care at an affordable price, and it works very well for people who are over 65 who need to see a physician.
So more people are going to telemedicine, or more people are using telemedicine?
A lot of people are going to telemedicine, especially the physicians, family practitioners that have known clients. They think it's great.
Are we reaching more people out in rural areas and smaller communities?
We are reaching people in rural areas. We still have an internet problem or access to internet in the rural areas, but we are doing a better job in the rural part of Mississippi, and especially in the Delta, With telemedicine, it's enabled us to reach people that normally would not have access to a physician or a family practitioner. The real issue for us in the rural areas of the state is that there's no discrimination by the legislature on funding other programs that we have to have. And I'm very open about that because I don't always agree. And I've been a member of the legislature, so I think I can criticize them a little bit. An example is fire care and rural health care. Mm-hmm. And those are two areas that are dear to my heart because I am the state fire marshal. But you need to fund those programs, and the state can afford to do that.
And you see something coming down the road with what's
Well, they
happening
didn't
now?
fund me this year, and I'm really not happy about it. Mm-hmm. They know it. So you look, we've got 16,000 people that volunteer their life every day to go save somebody they may never know. 13,000 plus of them are not paid a penny. They're volunteers. And when we have a Hurricane Sally that comes through our state of Alabama, the first people to go are the volunteers north of Jackson because they go down to the coast to relieve those firemen and first responders that have to go out on calls. Somebody's got to man the station. I just brought a 14-man crew back this morning from the Gulf Coast. You never read about that in the newspaper. But it's important that those programs be funded at the right level so they can perform what needs to be done in case there's a national emergency or a catastrophic event like Hurricane Sally.
All right, we'll see how it all plays out, but we got a lot going on for the remainder of 2020, and we'll see that people get insurance and mask up and follow what's going on.
You got it. This mask is important. It may save your life and the people you work with. Wear a mask, wash your hands every chance you get.
All right. Insurance Commissioner Mike Cheney, we thank you for joining us.
Thank you, Byron.
All right.
Always a pleasure.
And we'll be right back. Tonight, you may be looking to donate to people like victims of recent storms, but be careful about where you're sending your money. 12 News' senior political correspondent Gerald Harris talked to Secretary of State Michael Watson about how to avoid being scammed.
As storms batter the Gulf Coast and upending lives, folks may want to give their hard-earned money to help.
It never fails that Mississippians always rise to the occasion to help our neighbors.
Mississippians gave $1.7 billion to charity last year, but all that giving has scammers looking for ways to take their cut.
If you're on Google or your computer, search the organization that you choose and then include the term scam or something like that so you can see if some news will pop up about it. Also, if it's something like hurricane relief you're looking at, for instance, those who are undergoing hurricane damage right now, to our east, type in hurricane damage and then best rated charity.
Watson says you can use the Secretary of State's website to check out charities.
Use our website, the tools on our website to search the charities, making sure you understand exactly who you're giving to and what the purpose of the funding is.
And if you end up getting scammed, Secretary Watson says report it.
Number one thing that we can do, obviously, is get the background information, do an investigation, turn it over for prosecution to the local district attorney or the attorney general's office. But most importantly, that would be you're going to help someone else from going through the same situation. So you could bring attention to something that could be a scam going around the state.
Watson reminds Mississippians to continue to safely give, but give smartly. In Jackson, Gerald Harris, 12 News.
Well, the Federal Trade Commission reports that people lost more than $667 million to imposters. The scammers acted as the government, well-known businesses, or family members with an emergency. And we'll be right back. That's Mississippi Insight for tonight. Thanks to Commissioner Mike Cheney for joining us. For Gerald Harris, I'm Byron Brown. Join us again next week for another edition of Mississippi Insight. Until then, make it a good night.